Welcome. I'm at the National HealthTech Series event in Birmingham, which is a three-part series taking part with GBS, hosted at their campuses, in partnership with the National Institute for Health and Care Research, HealthTech Research Centre for Accelerated Surgical Care, DocHQ and Roseley Group. And these events are about bringing together innovators, academics, students, SMEs, startups and scale-ups, funders and more to explore collaboration, to explore how new innovations can get started that support patients, that address unmet needs in the NHS. My name's Costa Mavroulakis. I'm the founder and CEO of Impact Ventures. I'm actually Birmingham born in Sutton Coldfield, and so running these events for the National HealthTech Series with GBS is very special. Impact Ventures co-designed some of the leading tech initiatives, be them health tech conferences or medtech conferences. We scout innovation, and we're super connectors. We facilitate thousands of connections between people to address their mutual needs around business support, exposure, and their long-term development and sustainability.
The biggest challenge in the health tech industry? Oh, there is a few, I would say. One of them, it's definitely the lack of innovation funding in NHS trusts. So even though we've got amazing technology, which is going to sort multiple challenges, the lack of funding in the NHS for the innovation, that's a challenge which we need to overcome in multiple creative ways. Like, for example, we give our solution for a couple of months in exchange of patients for our research, but it shouldn't work this way, that we always need to be creative. So I think that's a massive challenge for sure. And funding itself as well. So when you're a pioneer like us in technology, it's so difficult with the pioneer funding. So there is funding for scale-ups, but there is such a limited amount for companies like ours. Even though the innovation was assessed as a breakthrough, it took us 2 years to secure funding to progress further.
I think the biggest challenge in the health tech industry is access to funding, but also because funders think it's very complicated, so that they tend to shy away. So we can access not only UK grants, but we can also, because we're a French company, we can also collaborate with our French team, our American team, to help you obtain grants through collaboration.
What I really love are those networking conversations when people are incredibly purposeful about the value that we can create together. And the real secret, in my opinion, is when one person is giving some value that is easy in terms of energy, time, investment for them to give, and super high value for the other person to receive. Those exchanges are where you really build flourishing relationships, where you can create long-term value together. And I can see so much of that happening here today.
I totally understand. Networking's not for everybody. It can be daunting, putting yourself out there, talking to people about your idea that you might be very protective over. And what I'd say is that you have to put yourself out there. You don't have to go and speak to people. You can just listen and learn. You'll be inspired. You might have opportunities to sit down with somebody one-to-one so that you're not in a huge group of people. You might join our clinics where you can get business support one-to-one. You could join the expo, and you could pick and choose who you actually want to talk with about your journey, about your challenges. I'd encourage anybody to get involved in these events or any events to support them on their path.